Well, getting older, yes, it's inevitable. But you don't necessarily have to look your age. As a matter of fact, you can fight it all the way if you want to. Here to help you look younger with little to no downtime, I want you to meet Dr. J.D. McCoy. He's with Contour Medical, and he brought along one of his beautiful patients, Kim Healy. Welcome to both of you.
Thank you.
Okay, you guys are going to love this because this is pretty exciting stuff. First of all, Dr. McCoy, as we get older, besides the obvious lines and wrinkles, what is happening to our face underneath?
Well, primarily what's happening as we age is we are losing volume. So as we lose volume, we lose the foundation that is holding everything up, and we start to get sag and a change in the face that makes the face more square.
Oh.
And you can see that the cheek that used to be nice and full loses that fullness, which causes the folds in the lower face to become more accentuated.
So what is it that you do differently to fix this problem for men and women?
What I do differently is I do a progressive correction. So I use a longer lasting product. My go-to product would be Bellafill.
Okay.
And when I'm doing that, what I'm doing is I'm adding volume that will be long lasting, that gives a natural correction that patients don't have downtime with.
Okay.
And most patients, they want their look to be very natural.
Sure.
So I've learned over time that it needs to be a progressive correction, meaning I don't do it all at once. We're going to do some correction, look at the result, add a little bit more, and gradually improve the volume over time.
And how much time are we talking about? I guess it depends on the patient, right?
Most patients will come in every 4 to 6 weeks, but there's a lot of flexibility.
Okay.
But at the same time, if someone wants to come in 3 months later, 4 months later, that's fine because this filler lasts 8 to 10 years.
8 to 10 years?
Yes.
Oh my God, like, big thumbs up from Kim. Now before we talk to Kim, I want to bring up her before picture because she hasn't seen this picture in quite some time. Kim, look at that picture. How long ago was that? Do you recall?
I think it was several months ago.
Yeah, I believe November.
Wow. Wow. Now, what do you see when you look at that picture, Kim?
A 55-year-old woman with jowls.
No, you know what? I want to take a look at you now, though, and if you'll just look at this camera, you look absolutely stunning.
Thank you.
Oh my gosh. Now tell me about this experience. Was it painful?
Not at all. Not at all. I felt nothing. I mean, he prepares your skin and numbs you. He's very good with technique, and that's part of the reason I chose Dr. McCoy.
So tell me what happened that first day when you went into the office and you went in looking like that. At the end of the injections, he handed you a mirror, and what happened?
I wasn't expecting the reaction. I held the mirror up, never imagining how I would feel at that moment, and I became overcome with joy and started to cry.
Oh my gosh, I'm sure that happens a lot, Dr. McCoy. Because you can see it right away. It's not like, you know, you have to wait for swelling or, you know, stitches or anything. This is like, you can go back to work that afternoon?
You absolutely can. But I think because the correction is so natural, I think when patients see themselves, they see their former self. And that is the goal with our correction, to rebuild the volume that's been lost so they look younger, but their younger self, not looking like someone else.
Someone else. And we all want that. Oh my gosh, what have you done? Because you look fabulous. You look beautiful, Kim.
Thank you.
Wow, that was really amazing. Dr. McCoy, thank you